This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu and you're watching Health 54. The Gombe State Commissioner for Health, Dr. Habu Dahiru, on Wednesday declared Kalachanga community in Akure local government area free from cholera. The information is contained in a press statement signed by the Commissioner in Gombe. On the 27th of May, the Commissioner for Health in the state declared cholera outbreak in Kalachanga community of Akure local government area of Gombe State. According to him, a rapid response team was deployed immediately and the cases were confirmed in the laboratory. A free treatment center for cases was established in Bogo Model Primary Health Care. And the World Health Organization, WHO, has said more than 18 million children and adolescents globally are being exposed to toxic e-waste. The global organization, which noted that some of the affected children are as young as 5 years, gave the statistics on Tuesday during the launch of its first report on e-waste and child health. The report, which is titled Children and Digital Dump Sites, noted that the affected children are actively engaged in the informal industrial sector, one of which waste processing is a sub-sector. And the World Health Organization decried the notable decrease in blood donation due to the COVID-19 pandemic. Mashidiso Moeti, WHO Regional Director for Africa, stated this in her message commemorating this year's Blood Donor Day. She explained that this year's theme was tagged Give Blood and Keep the World Beating, because fewer people had been donating blood during the COVID-19 pandemic. And still on a Blood Donor Day, as Nigeria joins the rest of the world to commemorate the 2021 Blood Donor Day, the Association of Resident Doctors FCT chapter has decried a notable decrease in blood donation and called on people to donate blood to save lives. The association made the call while sensitizing patients and Nigerians at the Asokoro District Hospital on Tuesday in Abuja as part of its activities to mark the World Blood Donor Day.
An individual is not up to 50 kg and above. We just have to certify them that they are not fit for blood donation. And also we check the hemoglobin level. If your hemoglobin level is below what is expected to be, you are not certified to donate blood.
Blood as one of the major products in the body that is required for the body to move, or the system of the body to move efficiently. It's a product that cannot be substituted for. You know, you can't get to the market or take, yes, you have nutrients that you can take that can help you build up the blood, but you cannot get it ready-made. So science has made it so important or so easy that you can now actually share this blood, especially for people that have similar blood groups. So, and you can't overemphasize that it actually saves lives for the mother, for the child, even for accident victims.
We encourage you all to donate, make it a habit to give life. Because for every blood you donate, you know, somebody gets a chance to live. So let's learn to donate blood, you know, not being forced into it. Let us not wait till an emergency comes for us to go and donate blood. 1 pint of blood can save one life or more.
Very essential. You don't know who you're going to save by actually donating blood for child and maternal care, for accident and emergency victims, even during surgeries. And it's actually very essential to emphasize, especially for those who have very rare blood types, like the O negative individuals. It's very difficult to actually come across or come by, especially when, you know, maybe a patient is in need of such blood type. So I'm actually encouraging Nigerians to actually come out and donate blood. It is safe. Before you donate blood, there are some screenings to be done, and when you come voluntarily to actually donate blood, those screenings are free. You don't pay a dime. So we're actually encouraging people to come out to hospitals, you know, blood banks, registered for.
One good thing about blood banking system is just like the normal money banking system. the body will be kept in the bank, the blood will be kept in the bank and can be used for somebody else who might even donate, and that one will be replaced. The money you put in the bank is not the money you pick up when you go to pick money, but you pick money as far as there's money in the bank. So let's keep donating to make sure there's blood.
Leaders of the major industrial nations have pledged 1 billion COVID-19 vaccine doses to poor countries as a big step towards vaccinating the world, Boris Johnson has said. At the end of the G7 summit in Cornwall, the PM said countries were rejecting nationalistic approaches. He said vaccinating the world would show the benefits of the G7's democratic values. There was also a pledge to wipe out their contribution to climate change. This is TOS Television, your digital-first Pan-African news network. You're watching Health 54. More stories after this timeout. Do stay tuned. Namibia has placed new restriction on public gatherings, limiting it to 10 people at every gathering and should not last for more than 2 hours if held indoors. The new restriction is coming after a decree was issued in Namibia on Tuesday in a move to stem the drastic increase in new COVID-19 infections, hospitalizations and deaths in the country. Our contacts with sports in the country are also temporarily banned, and face-to-face teaching in schools will be suspended to further notice. Helion Health, the largest electronic medical reports and hospital management information systems provider in West Africa, has launched its services in Kenya. In May 2020, the startup closed a $10 million series, a funding round to expand its services in both new and existing markets, launching operations in East, North, and Francophone West Africa. Helion Health has already partnered with facilities in Uganda and Liberia, onboarding their 90-plus users early in 2021, and is now extending its services to facilities in Nairobi. And President Cyril Ramaphosa on Tuesday says the rapid rise in coronavirus cases and hospitalizations in South Africa has led to the return of tighter restrictions on public gatherings and sales of alcohol. Ramaphosa said the 59% increase in COVID-related hospital admissions over the past 2 weeks threatened the health system in several parts of the country. And a novel vaccine candidate to prevent Lassa fever is set for a second round of clinical trials on adults and children in Liberia, Nigeria, and Sierra Leone. This is with the support of Coalition for Epidemic Preparedness Innovations and the European and Developing Countries Clinical Trials Partnership. Both bodies confirmed they jointly awarded £22.8 million to the International AIDS Vaccine Initiative for the exercise. And finally, before we go, the government of Japan has announced that it will provide approximately $39 million in emergency funds to United Nations Children's Fund for the development of vaccine cold chains in Nigeria and 31 African countries and Latin America affected by COVID-19. According to a statement by the APO Group on behalf of UNICEF Nigeria, the support from the government of Japan complements the work of the COVAX facility, an international vaccine procurement mechanism working to ensure that people in all countries have quick and equitable access to vaccines. With these funds, UNICEF will work with the government to provide cold chain equipment in priority storage sites based on gap analysis to improve storage capacity for vaccines and facilitate monitoring of the vaccine potency. That is the Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and thanks for watching.